chronic diseases. Why is there been an explosion of chronic diseases in the West? America over the last 75 years, same in Australia, we're paying more for healthcare than what we did every year. We're paying more for healthcare, and people are getting sicker and sicker with the explosion of chronic diseases such as type 2 diabetes, cancers, obesity, heart disease. All these things are exploding. Cancer rates, for example, at the moment, approximately 7,000 people die each day in China. Obviously, China's a big country from cancer. In America, it's about 1,700 a day. Australia, we're around about 150, 200 a day. Melanoma is obviously a big factor in Australia. But in the West, generally speaking, cancer rates are increasing, exploding. So what's causing all this? Has our genetics changed? Our genetics haven't changed over the last 75 years. Still got the same genes. There can be some gene involvement with some of those chronic diseases. Might make you a little bit more prone. But Harvard University says that our health is about 80% lifestyle, 20% genetics. Dr. David Sinclair, PhD, who lectures the medical students at Harvard, world expert on anti-aging and longevity, he says, he even goes a bit further, says that it's about 90% lifestyle, 10% genetics. The other thing too is if you've got so-called bad genes, there can be some diseases where if you've got the gene, you're 100% guaranteed to get it. There's no doubt about it. But if you've got the so-called weak gene or bad gene, that doesn't necessarily mean that that will be expressed. So you can stop that bad gene being expressed with good lifestyle. Okay, some genes you can't, but with most of the genes where they've shown that you've got an increased predisposition to that, with changes in lifestyle that can often stop that gene from being expressed. So lifestyle things are things like moving well, thinking well, eating well. So a pill or a surgery doesn't address that. Okay, if you've got an issue, a chronic disease which is caused by not moving well, thinking well, eating well, there's no pill or surgery which is going to fix that. Okay, and often, unfortunately, what happens, for example, type 2 diabetes, say if you're obese, what's going to fix it? Lose the weight. That's the only thing that's going to fix it. That's a lifestyle thing. If you don't lose the weight, what happens generally? Over time, you're on high doses of insulin, on metformin, things are deteriorating. As long as you're a type 2 diabetic, things are getting worse. Okay, your blood sugars might be stabilised, but as long as you're a type 2 diabetic, things are getting worse. You're more prone of heart disease, diabetes, cancer, amputations, all those sorts of things. If you are on any medication at the moment for any chronic illness, don't go off that medication without your health practitioner's guidance and approval. But you can see that the reason why we've got this explosion of chronic diseases, it's not a genetic problem. Our genes have stayed the same over the last 75 X amount of years. It's a lifestyle problem. So if you want more information on this as a client, simply ask when you're next in the clinic. If you're not a member of our practice, you can ring the clinic, come in for a consult, complimentary consult. We're happy to give you more information and help you if you're suffering from a chronic disease. Till next time, thank you very much.